Thank you for giving me the opportunity to present at SEEDS 2021. Our project is on the micro and small contractor mental health and well-being, looking specifically at the impact of Covid-19 on these companies in the Irish construction sector. This work was done in 2020 with Sean Henry, Caleb King, myself, Jim Bradley and John Spillane, and we're based in the Irish Construction Management Research Centre at the University of Limerick. With regard to what we're looking at here, there has been a lot of discussion recently with regard to mental health and well-being at both national and European levels, primarily driven by the nature of the industry itself and also by the type of people who work within the industry. And also taking into cognizance the fact that despite its size and its contribution to the economy, the sector is relatively fragile, especially when anything can cause an economic downturn. And this is effectively what we've seen when we've experienced the COVID-19 and its effects on the sector. What we've seen is it seems to have exacerbated problems that are within the industry, particularly when we look at mental health. So the aim of this pilot study was to actually look at the actual impact on people within micro and small contractors in the Irish construction industry from the onset of COVID-19. When we look at it from the point of view of how these guys operate, as usual, typically you would see elements like there's always resource issues, margins are exceptionally tight, stress levels are high with regard to consistently having to look for work and price work and then try and, resource work when you do get it. There's also the elements of a high level of travel and work-life imbalances that are particular to people who work within the industry. With COVID-19 and the lockdown, this added fuel to the fire of mental health issues that people working within these companies can sometimes experience. And then we've had another, aspect to it as well, in that the return to work protocols have added even more pressure because now there is another set of guidelines that have to be implemented to keep the workplace safe. Our research design focused on a couple of different elements. First of all, the participants were selected as having worked in micro or small enterprises. So we had a fairly discrete group. They had to be based in Ireland and they had to be able and willing to participate. And basically the participants were either subject to open-ended interviews. We had 12 industry professionals who were willing to be involved in that. They were interviewed for between 25 and 35 minutes on the phone. And then there were 35 people responded to a questionnaire that we sent out that had 50 questions on 3 core themes. Number 1, mental health in construction. Number 2, the impact of COVID-19 on mental health in general, and also the impact of COVID-19 on the construction industry in particular. As I say, we anonymized the responses that we got from these, and we had 35 respondents. The results that we got were obtained when we actually analysed the results from the interviews and also the questionnaires. We used Likert scales and we also analysed the frequency of occurrence of the mention of specific factors in the interviews. We'll talk about those later. Mental health would be seen as not being prioritised compared to, say, traditional health and safety on sites and within companies. And there has always been the issue of the sufficiency or availability of resources, especially within the micro and SME enterprises, and it's just not enough. You've also balancing this, or with regard to the attitudinal factors that we meet, particularly within the male element of the construction industry personnel, and that would be this macho image that they have, and this has a negative impact on the mental health, not only in terms of the occurrence of mental health issues, but also in the discussion of mental health within the workplace. The nature of the business itself has also a negative impact on, say, stress levels, and this was exacerbated with COVID-19. Specifically with regard to COVID-19, what we found was the smaller the company, the bigger the negative impact that COVID-19 had on the mental health of the people working within it. Primarily down to the rise in uncertainty. When are we going to get back to work? How long will we be back at work for? What are the supply issues going to be like, etc. Because of things like social distancing and also the close down of all social outlets, you couldn't go to the pub, most sports were closed down, etc. There was a reported increase in isolation within people who work in the industry. People were also being absent from work when work started. This was driven by sometimes the fact that they were vulnerable, but also times where they were scared to bring the virus, maybe from the workplace, back into the family home. However, companies reported that there was no decrease in productivity once people came back to work in a lot of cases. And there was a general view that the change in work practices had a positive effect. But even though that you had an appreciation of people being back to work and getting their wages again, as compared to the €350 a week that was part of the pandemic unemployment payment, the PUP here in Ireland, there was still a negative impact with regard to relationships within houses, driven primarily by fear in terms of people going out, mixing in work, and then perhaps bringing the virus back into a household, especially if there was a vulnerable person living within the household. The micro and SMEs account for almost 93% of personnel working in construction in Ireland, and yet when we spoke to them about the interventions that are there for mental health, most interventions appear to be aimed at larger companies. And the respondents all spoke about a lack of support for micro and small to medium enterprises in the construction sector. And an interesting point was we found out that personnel will actually talk quite openly to researchers, but they won't talk openly to their colleagues, again referring back to this macho image that construction workers tend to have. This is further exacerbated by the fact that we have low margins, tight deadlines, which means that we have neither the time nor the money to spend discussing our mental health or putting interventions in place that would actually help it, or giving people the opportunity to discuss it, because in the small to medium enterprises, the resource just isn't there. What also came out was, due to the lack of social interaction, like for instance sports and meeting with friends in the pubs and so on, this seemed to have a particular impact on the mental health of people working in construction, maybe exacerbating the fact that they have long commute times, so they're in the car on their own or whatever. In some cases, they work on their own as well if it's a one-man band type micro enterprise, and the fact that they were socially isolated after work impacted on their mental health. So what can we do about it? What are the conclusions that we could reach from this type of feedback that we got? The first one is we need to involve people from micro enterprises and small to medium enterprises when we're developing interventions. We need to show, for mental health, for instance, have companies got the resources to allow appropriate implementation so that the effect is positive. We need to also look at, can we allow a situation to evolve? Can we promote a situation to evolve that would allow the normalization of discussions about mental health on site? Work by Clark in 2019 showed that there was quite a stigma attached to people within the construction sector talking about their mental health. COVID-19, I suppose, exposed a lot of issues that were maybe under the surface, and we have to look at a way of recognizing the impact on both individuals and on their work processes, so that we can achieve a balance between their own safety in terms of physical well-being and public health safety as well, and being cognizant of any impact that it might have on what we'll call their mental safety. So when we're looking at an issue like COVID-19 coming in, again, you've got this thing about normal health and safety, public health safety, and mental safety that all need to be considered and taken into place. And we need to align the controls that we have in place for work practice to allow these three entities to coexist, and perhaps even to positively impact on each other. And this boils down a lot to communication. It needs to be improved not only across industry and with the supporting bodies, but also within the enterprises. This was something that was discussed with regard to our respondents. So the implications in the construction industry, COVID-19 is not only a public health issue, but the mental health aspect needs to be considered. We know that resilience is a fairly common trait in construction workers, but what we found was that they reported that their resilience has drained because of COVID-19. It was just an additional factor that in some cases tipped them over the edge. And we need to have a specific focus to ensure that any interventions that we have are suitable for the micro enterprises and the small to medium enterprises that are involved in construction. So thanks for listening to that brief presentation. If you have any questions, please drop me a line, or I'd be happy to take any questions now. Thank you.